Presentation on Opioid Addiction by Tara Shaw, an Indiana State University LPN to RN nursing student for community health. Viewers will learn what medications are opioids, the proper medical uses of opioids. Viewers will learn reasons behind addiction, the population that is at risk. Viewers will recognize signs of uses, withdrawal, and overdose. Viewers will learn different treatment options and learn prevention and intervention. And click on the link for the pre-test to test your knowledge, and click on the brochure for you to print out. What are opioids? They're a class 2 scheduled drug that's made from the opium poppy plant, and this is where illegal heroin comes from. You can make synthetic forms, which is a fentanyl patch, prescription forms, oxycodone, hydrocodone, morphine, codeine. The Adderall and Ritalin are used to treat ADHD. These drugs have high potential for psychological and physiological dependency. The most common use is for moderate to severe pain. The less common uses is for people with diarrhea and cough. Opioids can be ingested by taking them orally, inhaled through the nose, injected into the vein, and smoked through pipes. What risk factors contribute to addictive personality? Most contributes they're affecting the brain function, and this can start in the womb. Addicted mothers injecting themselves. It affects the growth and development of the child. This leads to physical and learning disabilities. The children develop an insecure attachment disorder. They're being neglected. This leads to mental health conditions and an increased risk for substance abuse. Someone has a traumatic event or stressful situations over and over. This increases the neurotransmitters in their brain. Soldiers at war, a child being raped, an adult being raped. It's a traumatic event. The society that we live in, having peer pressure, gangs, medical providers are over-prescribing narcotics. The population at risk, your elderly. More people are living longer lives, and their bodies hurt. They have chronic pain. Adolescents, they're experiencing life. They don't know. That's why we have to teach them the right way. Mental illness, which affects so many individuals. People with chronic pain, acute pain, a family history of drug abuse, the environment and the income that they live in. Recognizing changes in an individual early can hopefully lead them down a different path. You notice a change in their behavior. They're missing work. They're irritable. Excessive spending money. They end up turning to crime for their drug. They're changing their physical appearance. Weight loss, weight gain, tooth decay, excessive sleeping. On opioids, they have the pinpoint pupils. They also can be red. Learning to recognize signs and symptoms of withdrawal, the body becomes dependent on this drug. So without it, your body goes a little crazy. You can be hallucinating, confused, agitated, sweating, diarrhea, physical pain, anxiety, insomnia, nausea, tremors, and depend on the individual. It may not be safe to try to detox on your own. You may need to go to a facility and have them help you and give you medications during the time to help you with these withdrawal symptoms. Recognizing an overdose can save a life. Call 911, and if you're with somebody that you know that is a drug abuser and their family knows and they may have Narcan, the person is extremely pale, clammy, their body's limp, they're vomiting, unable to arouse them, they have really slow, shallow breathing, and a slow heart rate. Calling 911 gets the medical providers there that they can also administer the Narcan, which reverses the effects of the opioid. The research paper on prescription opioid and the heroin crisis. In 1997 through 2011, the stats showed patients seeking treatment for addiction increased to 900%. It's proven that opioids leads to heroin use. Heroin is cheaper and easier to get. The Joint Commission, they added the fifth vital sign to be pain. So providers wanting to satisfy their patients and the Joint Commission, they're providing more narcotics. Drug manufacturers, they want their money, so they're promoting narcotics. They're safe. There's no long-term effects, which isn't true. The survey of youth and children and college students, they believe narcotics are safe. So that puts them at an increased risk for use. Taking a Percocet or a Vicodin, it's not going to hurt me. Changing policies on prescribing, we did that. It's just not enough. Providers need to be more educated, offering different treatment options, using diet and exercise as a way to lose weight to help with pain, not prescribing narcotics and using analgesics, using a chiropractor, acupuncture. Remember, fighting this addiction, you are not alone. Evidence-based practices have proven that rehab centers focusing on psychosocial treatment, behavior, and individual therapy has been the best. Pharmacological medications using methadone and Narcan, having a support system using Narcotics Anonymous. Find out what your emergency hotline is in your area. For Pittsburgh, Allegheny County, we have Resolve Crisis Center. They are open 24 hours a day. You also have walk-in clinics that you can go to. There's mobile, and there's the UPMC website. The research article also focused on prevention and interventions. The primary, preventing new cases, starting with addicted mothers. supporting them through their pregnancy, through their treatment, through their recovery, to parenting skills, to preventing neglect on a child, preventing that child to have traumatic events happen in their life that causes them mental illness and increased risk of substance abuse. Secondary, identifying the early signs of abuse from your family and friends to helping you get help, to the providers treating the whole patient, examining every aspect. They're in pain. Why are they in pain? Is there more pain inside? Mental illness is pain. The tertiary, effective treatment options. It's proven that psychosocial and individual therapies help. We also have to prevent overdose and death and the advancement of their disease, from opioids to the heroin. I hope you find this video educational.